Hi, my name is Jonathan Burke with Therapydia NOLA, and today I wanted to talk to you about the shoulder. The shoulder is a complex series of joints that will function together to position the hand. Approximately 6 million shoulder injuries are reported each year that require surgery and/or rehabilitation. One of the most common clinical diagnoses of the shoulder is a rotator cuff syndrome or rotator cuff tear. It is important to note that a large percentage of tears are asymptomatic and require no treatment. Symptoms of tears may include pain, weakness, clicking or popping with movement, stiffness, or instability. Individuals with rotator cuff tears can do well without surgery. With the exception of an acute atraumatic tear that results in an abrupt loss of motion and strength, there is usually an opportunity for non-operative management. This is particularly the case for partial thickness tears and on one hand and larger atraumatic tears on the other. A recent study in the Journal of Shoulder and Elbow Surgery concluded non-operative treatment using a physical therapy protocol is effective treating atraumatic full thickness tears in 75% of patients followed up for 2 years. Depending on your physician, you may begin rehabilitation as soon as 1 day post-operatively. 3 important keys to rotator cuff rehab are to restore passive range of motion quickly, restore dynamic humeral head control, and maximize external rotation strength. Passive range of motion should be issued immediately in a gradual and cautious fashion. Studies have shown that gradual passive range of motion into flexion and external rotation actually decrease strain on the rotator cuff repair. We still need to be cautious with adduction, extension, and internal rotation. The rotator cuff has to function properly to allow active mobility without restrictions. We can re-educate the cuff through general isometric exercises and rhythmic stabilization drills. It is extremely important to maximize external rotation strength following rotator cuff repair in order to balance the anterior and posterior cuff. As a patient, it is important to note recovery from rotator cuff repair is a process and can take weeks to months. There are a few things you should know prior to surgery in order to enhance your post-surgical outcomes. The stronger and more mobile your shoulder is at the time of surgery, the better you will be following surgery. Preoperative stiffness had a negative effect on recovery and delayed patients' return to functional activity.